come through. How's that?
Good.
Comfortable?
Yeah. I'm very comfortable with my teeth.
I was very conscious about my teeth, especially growing up. Going from school to university. I used to have ingrown teeth. Which really affected my appearance.
I first met Shaz about 9 years ago, and at that point he was very anxious when he first came in, really didn't think that he'd be able to cope with having any dentistry done. He had very poor oral hygiene, a lot of plaque on his teeth, which he was very self-conscious about, and his gums bled all the time. He struggles with being able to swallow, and he needs to be quite upright, and to actually cope therefore with having his teeth scaled was going to be very difficult for him particularly because of the involuntary movement. We worked together to come up with a solution for that, and so we very lightly sedate Shaz with midazolam, and he responds to that brilliantly, and it helps his muscles to relax, so it helps the involuntary movement quite a lot, allowing us to do the dentistry that we need to do. I think a lot of our patients, when they first come to see us, are very concerned that they might not be able to cope, that dentistry is going to be very difficult for them, for whatever reason it is. So perhaps we might have somebody with a learning disability who's coming in, and they're worried that they won't be able to understand the information that we're going to give them, that we won't give them the time perhaps to process that information, and that might worry them. Or somebody like Shaz today who is in a wheelchair and has to get from the wheelchair into the dental chair. That can be a worry. Everybody will have their particular concern. So frailty is something that is being focused on a lot within HCT at the moment. It's also an emphasis within the NHS long-term plan as well. And for a lot of our patients will fit into that frailty category. Shaz definitely fits into that frailty group. But it is a wide remit, so you can have a lot of very young people who are very frail, going all the way up to a lot of our elderly population. Oral health is incredibly important for anyone who's frail. If you have a lot of other things going on in your health, if you have some medical conditions which are going to impact on your health, making sure that your mouth is clean and that there is no infection there is absolutely important. Shaz can't brush himself because of his involuntary movements, so he requires therefore a carer to do that for him. And so it was working with his carers and with him to come up with a way that he could manage to cope with his teeth being cleaned. And it was a slow process, but the mouth that he has now, there is no bleeding. His gums are really lovely and pink and healthy, and he smiles with so much confidence now, and it's really wonderful to see. It's been very rewarding.
So it has changed everything I've thought about oral hygiene. For the better.
Thank you.
All right, my lovely.